Hi there, I'm Dr. Belis Aladag. I'm a family physician at UCLA. I see kids and adults, and I provide primary care. So today we're talking about cholesterol and your health, and hopefully you'll find this webinar helpful as a general guide, and I'll answer your questions as we go along. Reminder about the questions, this is a live webinar, so you can go on Twitter, hashtag UCLAMDChat to ask questions as they come up, and then I will have a chance to answer them towards the end. And I have no financial interests or other relationships with manufacturers of commercial products or any supporters. So, 5 basic things I would like to convey to you today. One is cholesterol isn't all bad. We do need some cholesterol in our bodies. Number 2, cholesterol is different than fat, and some fats are actually good for you. 3, try to avoid saturated and trans fats because they cause you to produce more cholesterol. And 4, there are plenty of cholesterol-lowering foods to choose from out there. And 5, remember that plants have 0 cholesterol and high amounts of fiber, which lowers cholesterol. So plants are your friends when it comes to lowering cholesterol. So what is cholesterol? We just said it's not exactly a fat, but it is a fat-like substance. It's waxy, and it's found in all the cells of your body. The liver makes all the cholesterol that you need, but you do also get it in your diet, in the food that you take in. So what does it do? Cholesterol, it's, like I said, it's present in all the animal cells and animal-based foods. So it's an essential nutrient necessary for many functions, including repairing the cell membrane, manufacturing vitamin D on the skin surface, producing hormones like estrogen and testosterone, and it's also been linked with possibly helping connections in your brain for learning and memory. So the way cholesterol and fats are carried in the body are in little packages. Cholesterol is carried in packages called lipoproteins, and the fats are carried in what's called triglycerides. And you can see here there's several types on this picture here. This is the high-density lipoprotein, which means that there's a lot of proteins. You can see the green. Oops, sorry, go back to that. The green is protein. So that's why it's called high density. There's a lot of protein in that, in the package. And the yellow stuff is the cholesterol. And then there's the low density lipoprotein, which has less protein in it and more cholesterol. So those are the good cholesterol and the bad cholesterol, and I'll get into that in more detail in a minute. All right. So bad cholesterol is the low density because it's mainly composed of cholesterol, very little protein, as I said. And the reason it's bad is because it carries cholesterol that's made in the liver. It carries it from the liver and it deposits it into your arteries where you don't want them. It puts them in the artery walls and it causes buildup and plaques to form over time. So high LDL levels increase your cardiac risk over time. HDL is the high density. So again, it's called high density because of the more proteins, less cholesterol in that package. And it's actually good because it puts the cholesterol out of those artery walls and carries it back to the liver, which then removes it from the body. So the only way to really get rid of your cholesterol deposits in your arteries is to have this high density cholesterol, the good cholesterol, come take it away from the artery walls and package it back into the liver and out of your body. So it is cardioprotective to have good high amounts of HDL. So here's a picture. HDL is sweeping and cleaning, and the LDL is just kind of wreaking havoc there, depositing in the walls. So, so high cholesterol, why is it a bad thing? Well, as we mentioned, it's depositing these fats, these cholesterols into the wall, and over time it can start blocking those arteries that are supplying oxygen and vital nutrients to your tissues. That's bad. The other thing that can happen is these plaques that form. So when the cholesterol is deposited into the artery walls, it also attracts other things like calcium in there, and it forms these hard, easy to chip off kind of plaques. And then if they do chip off or break a little bit, they tear a piece of the artery wall, and there's bleeding involved, so then you get more like a scab almost formation there, and it narrows the wall even more. And then finally, you can have the whole thing chip off and block the entire artery, and that's when you have problems like strokes or heart attacks. So plaque, as I mentioned, made up of cholesterol, fat, calcium, and other substances that are found in the blood. And as they harden and narrow the arteries, we call this disease atherosclerosis, basically narrowing and hardening of the arteries. And again, these can break open, and a blood clot can form around it. So a heart attack will happen if that piece of plaque tears off and then blocks the entire area, and you can't get oxygen to one of the most important organs, your heart, and then a piece of that area that's supposed to be supplied by that artery dies. That's what a heart attack is. So people with high cholesterol are twice as likely to have heart disease. Stroke, I mentioned, you can also have, because just like the heart and every other organ, you need good oxygen-rich blood to be flowing into your brain. If that gets blocked off by the same process, you end up with your brain tissue that dies in that area, and that's a stroke. So again, going over the whole thing, high LDL, the bad cholesterol, keeps the cholesterol in your bloodstream, in the artery walls, and deposits it there. Atherosclerosis is the disease that is formed by this process. Plaques form because they get hard items such as calcium and other deposits in them. They narrow the lumen of the arteries, and then you end up with the strokes and heart attacks when those plaques either obstruct fully because they become so large, or usually they chip off and then they block that way. So speaking of LDL, a common question is, okay, well, what's a good amount to have? How low do you have to be to be safe, to be healthy? So it depends on your cardiac risk factors. It's obviously, just looking at this, you can tell the lower the better. The lower the LDL, the better for you, the less spilled up in your artery walls, the less disease that you'll have. But it's not one size fits all. If you have certain cardiac risk factors that put you at higher risk of having heart disease, then your goals are stricter. You should have, less wiggle room. So the cardiac risk factors we look at are having a first-degree female relative, so a sister or your mom diagnosed with heart disease before the age of 65, or a first-degree male relative, so either your mom, your dad, or your brother, if they had heart disease before the age of 55. That would be considered one cardiac risk factor. Being male and over the age of 45 puts you at another risk factor. Being female over the age of 55 puts you at another risk factor. Cigarette smoking, diabetes, and high blood pressure. So the high blood pressure is important to note that it counts against you as a cardiac risk factor whether it's uncontrolled high blood pressure. Let's say you're not on any medication, but your level of systolic blood pressure is over 140, or your diastolic is over 90. That's considered high blood pressure. Or you could be on medication to control it, and it's now controlled, but the fact that you're on medication, it still counts as a cardiac risk factor for you. And then finally, something called metabolic syndrome. And so this is associated with obesity and low HDL, that good cholesterol levels, and high triglyceride levels would put you at this metabolic syndrome, which is in itself a cardiac risk factor. So looking at a cholesterol result, a lipid panel result with a patient, the first thing I do is look at the LDL, which is the bad cholesterol. Ideally, this should be under 100. But again, depending on your cardiac risk factors, your goal can be less than 130, or your goal can be less than 160. Meaning, if you don't reach those goals, if you're above your goal, then we start talking about putting on some medication to lower that cholesterol. And the way you know if you should be less than 160 or less than 130 is by looking at your risk factors. If you have less than 2 cardiac risk factors, you should be less than 160. If you have 2 or more cardiac risk factors, but no known heart disease, then you should be less than 130. And then finally, if you have a previous heart attack, you've had angioplasty, bypass surgery, or you have diabetes, you should definitely be less than 100. Next, I look at the HDL, the good cholesterol. And ideally, this is over 40. And then finally, I look at the triglycerides. The triglycerides ideally are less than 150. And then last, we can look at the total cholesterol, which ideally is less than 200. But remember, the total cholesterol is a composite of both good and bad, so it doesn't necessarily mean if it's higher than 200, it's all bad, because maybe that's coming from the HDL component. All right. So the problem with the low-fat diet. So too many people assume that lowering your general fat content is enough to reduce heart disease. They end up replacing the fat with refined carbohydrates like white bread, pasta, rice, potatoes, sugar, and all of these increase the triglyceride levels, which is the fat levels in your bloodstream. So over the past 20 years, Americans have reduced the total amount of calories they get from fats, but the rate of obesity is increasing, interestingly enough, and heart disease is still the #1 cause of death for both men and women in the US. So, so what is needed? So it's not the amount of fat that you eat that makes a difference, it's the type of fat and the total amount of calories. So total amount of fat in your diet is not linked with weight or with disease. And what matters is that type of fat, and I'm going to get into that in a minute. So when you're looking at how to modify your diet, I would focus on lowering cholesterol and certain types of fats, not just in general going for a low-fat diet. All right. So the first kind of fat you should try to avoid is saturated fat. Saturated fat most commonly comes from animal products. The biggest contributor would be red meat, but it's present in white meats too, like chicken and turkey. They're leaner, so that's why we prefer that over red meats, but they still have cholesterol. And so saturated fat, why is it bad? It stimulates your liver to produce more cholesterol. And itself, saturated fat itself, it also contains the same products that contain the saturated fat contain cholesterol. So you're getting in dietary contribution of cholesterol, plus you're stimulating the liver to make more cholesterol. So it's a double whammy there. One thing to note is there are vegetable sources of saturated fat like coconut oil and palm oil. These are saturated fats as well. So the goal is to limit your saturated fat to less than 14 grams a day if you can. Okay. Also getting back to that, dairy products fall under this category as well. So any cheeses or yogurts, anything that's full fat, you want to reduce to like skim. Or you could just have a smaller portion of that cheese you really like. You want that full fat cheese, that's fine, but just have a smaller portion. Trans fat is what's created when you try to change liquid fat into solid fat through a process called hydrogenation. So anything that says partially hydrogenated is trans fat, and it's not good for you. It essentially works the same way as saturated fats. So it stimulates the liver to produce more cholesterol. This is found in fried foods, pre-prepared baked goods, cakes, cookies, donuts, you know, the yummy stuff. So you want to avoid these. And the other thing about trans fats they're finding is they're associated with increase in inflammation in your body, in certain cancers, and of course in heart disease. Since 2006, the FDA mandates all manufacturers to list the amount of trans fatty acids on their products, on their food labels. So you can easily find out if it's present or not. Okay, so the good news, the good stuff that's good for you, are monounsaturated fats. So those are olive oil, canola oil, high oleic safflower oil, nuts, avocados, sunflower oil, and peanut butter. This you can have up to 40 grams a day of monounsaturated fats. And these are good for you. They will lower your triglycerides, which is the fats that's going around in your bloodstream. And also you should get some omega-3 polyunsaturated fats. These are great because these actually increase the good cholesterol, the HDL, which in turn cleans up your arteries and gets rid of the LDL for you. So this is a good one to have, the omega-3. So this list, walnuts, fish, especially salmon, canola oil, soybean oil, flaxseed oil. It should also include chia seeds, which have been becoming more and more popular lately. Chia contains omega-3 fats. Chia also contains some fiber, which we'll talk about soon. That also decreases that bad cholesterol. So omega-3, you can go up to 20 grams a day of this. And so talking about fiber, you can increase the whole grains in your diet to get a good source of dietary fiber. And fiber itself will take away that bad cholesterol, lower your cholesterol for you. So whole grain products versus those white products, the white bread, the white rice, go for the whole grain. Barley, wheat, bulgur, whole rye, switch from the white bread to the wheat, and the pasta, the brown rice. Cereal such as oatmeal or bran flakes can reduce your cholesterol because of the fiber in it. And the quinoa, bulgur, and barley also becoming more and more popular, easy to find in most grocery stores these days. They're a good way to kind of get your fiber in there. You can have a cold salad or something like that, mix it in. So fiber, you want to get something like 30 grams a day if you can, focusing more on the soluble fibers. So the soluble fiber is the type that dissolves in water. It's found in beans, oats, flaxseed, oat bran, and let's see, okra, another source there, soy, almonds, walnuts. Okay, here's another reminder about how to stay healthy and on top of this thing. Here's the percentage of adults that had their cholesterol checked within the past 5 years. This is a 2007 survey from the CDC. And you'll see the darker colors are where it was greater than 79%. And the lighter colors is more like 60% or less. So not many people are getting checked as they should. And so it's important to go to your family doctor, for example, and come in for an annual physical, because we may catch things like this. Because high cholesterol doesn't have any symptoms usually, unless you end up with a heart attack, but then by that time, there's so much that could be done before you reach that point. So it's good to get screening tests, get your blood tests checked by your doctor, and usually it's around every 5 years or so if everything looks normal. And what else can I tell you? That's pretty much it. And I'll move on to the questions now. All right. So, is there a way to reduce the amount of plaque buildup I already have? So, I answered this question through the presentation. The way to reduce the plaque buildup you already have is to increase your HDL, that good cholesterol, by supplying yourself with a lot of omega-3 fatty acids, so fish oils, salmon, walnuts, avocados, chia seeds, flax seed, things like that. That will take away the bad cholesterol from the artery walls and take it back into the liver and then hopefully out of your body. Are there medications to help lower cholesterol? And yes, there are. We have very good medications to help lower cholesterol. The most effective and most commonly used class of those drugs is called statins. You may have heard of Lipitor and other Zocor, etc. These do help lower cholesterol. They're very effective. Some of them in the statin family also have a cardioprotective quality. In addition to lowering the bad cholesterol, they also have this quality of stabilizing those plaques so that they don't chip off so easily. They kind of keep them protected so that you have less rates of strokes and heart attacks. So those are good drugs. Does stress raise cholesterol levels? This question I'm not too sure about. There may be hormones involved and pathways involved where certain chemicals released during stress times, like cortisol, may stimulate the liver to produce more cholesterol, so that may be true, but I would have to look into that. Does exercise help to lower cholesterol? Yes, exercise can help lower cholesterol levels. Mainly, there's several mechanisms I think they're still studying, but basically the main one is when you lose weight because of the exercise that you do, you tend to have less LDL, that bad cholesterol in your body. So that's kind of how that helps. Should children have cholesterol screenings? So I mentioned in my talk that people should get checked. And when I said people, I meant adults around the age of 20 and above should be checked every 5 years. That's for sure. Children, it's another story. It's kind of debatable, and there's a lot of different thought processes going on. But the American Academy of Pediatrics recommends that if the child is between the age of 2 and 10, and there's a family history of cardiac disease or high cholesterol, then yes, you may want to check them between the ages of 2 and 10. If there is no family history, you could still check them if they are, they personally seem to have higher risk of heart disease. For example, if they are obese or if they have diabetes, you may want to check and screen the child for cholesterol levels. And are there better foods to eat if I have high cholesterol? Yes, there are. Just review everything I just went through. But basically high fiber, high omega-3 fatty acids, and unsaturated fats, and very low saturated fats, almost none trans fatty acids, and you'll be fine. And then I heard that blueberries really help cholesterol levels. Should I eat more of them? Blueberries have a lot of fiber. They're also known to have some antioxidant properties, so these are all good things. So yes, absolutely, you can eat your blueberries as a source of fiber, but that's not all you need, and you can just review the presentation for more. All right. I think that's about it. Thank you.